think like the cow, the child, and the patient, which might seem like pretty different things, cows, children, and patients. I'm going to start by talking a little bit about livestock handling in the United States. 1/3 of the cattle and the hogs in the United States are handled in equipment designed by Dr. Temple Grandin. Dr. Grandin is a world-renowned expert on livestock. She's a professor, she's a writer, she's an inventor, an advocate, and she has autism. Dr. Grandin's designs have greatly improved the experience of cattle, hogs, their human handlers. They've reduced animal injuries, and they've reduced animal death. The fundamental thing that Dr. Grandin did, different than everyone who came before her, what was it? She thought like the cow. She began by imagining and understanding the experience of cattle. What do cattle see? What do they feel? What is it like for them to go through a veterinarian system? By understanding and articulating these things, she was able to design a system to radically alter the mechanics of systems that had come before her to make them better, both for the cattle and for the people who worked in those systems. The medical system and the youth justice system, which is the system I work in, could significantly improve outcomes, those of the people they serve, those of the people who work in them, by taking a similar approach. What would these systems look like? What would they feel like? What would their operation and architecture be if they took into account, if they really took into account, if they deeply took into account, if they embodied what it was like from the perspective of the people who were being served? What is it like to see the world through the eyes of a cow, a child, an incarcerated child, a patient? And how do we build systems that are fundamentally and in every single way humane for the people who go through them? So I want to start by talking a little bit about what do the youth justice and medical systems have in common. This is by no means an exploration of the entirety of the system, but it's interesting for me as someone trained as an attorney who works in the youth justice system to speak before you, students who are interested in pursuing medical careers, medical practitioners, and to think about the worlds we operate in and we want to operate in and what are similar about them. Well, both systems have a stated goal of helping people, of rehabilitating them, of fixing something. The design and operations of both systems, however, often betray this goal and have very little in common with it. The architecture, including the lighting and the beds, often don't support this goal either. When my dad was hospitalized for many months, one of the things I really noticed is how awful the lighting was and how that impacted him. What it was like to be at some point in an ICU in a room without a window, but even to be in a regular hospital room without regular light. So I brought in a lamp that I bought for like 20 bucks at TJ Maxx and had a nice screen, and we turned off the overhead lights and we had nice lighting. And it really impacted the way he felt to be in that room, but it also impacted us, his family, who had to come to the hospital day after day for many months, and it impacted the practitioners. So much so that a nurse later told me that she took photos of it and gave it to a research committee, and they wanted to investigate getting lamps for everyone in one hall to see if it made a difference in outcomes. That's what I'm talking about. I'm talking about how lighting, how beds, how people feel about the environment they're in changes what happens to them in real ways, not in their emotional health, in their well-being, but also in more traditional outcomes, the ones that doctors traditionally measure or that the youth justice system traditionally measures. What else is similar between these systems, between the criminal justice system and the medical system? Well, people who go through them often feel dehumanized and depersonalized. You heard a little bit about this earlier today. So I'll give a different example from my experience going through the hospital with my mom. I remember she was hospitalized with a terminal illness, and she talked. She was so profoundly impacted by the experience she had on a stretcher. She was waiting to be brought to a test, one of many, many tests that you have when you're very sick in a hospital and when you're terminally ill. And an attendant came up behind her and just started wheeling her to an appointment. Didn't introduce himself, didn't say where they were going, didn't say hello. And she talked about having to just lay there and be wheeled by someone who didn't even bother to say who he was or where they were going. And she contrasted that with someone later, a different attendant, who introduced themselves and said where they were going and took care when they were going around a corner or through a door. And that's not just about attendants, that's about doctors and nurses and administrators and everyone who works in a medical system or hospital. The kinds of choices that you will make, that some of you are already making, that impact the way people experience being ill, experience illness. It also is true in the youth justice system, in prisons, where people often are powerless and are often depersonalized. People in hospitals, people in the juvenile justice system, they often don't wear their own clothes. They're put in uniforms. I was recently with someone in an outpatient doctor's appointment who was meeting the doctor for the first time and expressed how uncomfortable they were that they had to get dressed in the gown before they met the doctor because they didn't want to meet the doctor in the gown. They wanted to meet the doctor in their own clothes so they could feel more empowered. But the system, someone asked about time before, right? The system doesn't allow that. The system doesn't give the time for someone often to meet their doctor in their clothes, at least for the very first appointment, especially with a serious illness, and then take a moment to change into a gown. Sometimes that's permitted, but it's not the way that we do business. It's not our usual way of doing business. People who work in these systems are often given elevated power. Doctors, prison guards. There's a real uneven balance of power. I'm not saying those are the same role, but I'm saying there's something essentially similar about them, which is an elevation of power that often is unquestioned. Another thing that's similar is that people who are inside these systems often fear asking questions. You know, the last presenter spoke a little bit about that. People won't always know, but they also don't always ask, and sometimes they're afraid to ask. Again, in the justice system, we're talking about an even bigger imbalance of power. We're talking about people who really might be abused for asking questions or being perceived as talking back. So it's not the same, but it's worth asking, what does that kind of power do? What happens when people can't ask questions about their own lives or their own bodies or what's going to happen to them? Another thing that's similar is people inside both systems are separated from their social supports. Again, it's more extreme for children who are in jails and prisons, but people, particularly in hospitals, are separated often from their families and their friends, or they can only be there at certain hours or certain times of the day or when certain things are happening, or inside a room where a test is happening. Right? Now, again, you might think, and as you enter the medical profession, you might think, is this always necessary? Right? Sometimes we're given this reason, like it has to be that way. I'll talk about another example when my dad was hospitalized, and they were trying to give him a test that was, he was critically ill, and it was a very important test, and they couldn't get him to raise his arm to do this kind of imaging, and I was told they can't do this test because no one could get my dad, who was very weak and really seriously critically ill, to raise his arm, and I asked if I could try, and they let me in the room. And it was a place where they don't normally let family members, but I was able to talk to my dad in a way that he was able to raise his arm. I could do that because I love him. I could do that because I'm his daughter, and I've spent my entire life with him. And I knew how to talk to him in that moment that no medical professional was going to be able to do. It's not that he didn't want to do it. It was that he was dying and in a really difficult situation, and he couldn't find it in himself to raise his arm in that particular way. But we were able to communicate in a way that could make that happen, and they were able to do the test. And that happened because I'm a professional advocate. And so when someone came and said, we can't get your dad to do this test, I knew enough to say, let me help, let me try. Can I do it? I know how to talk to him. Right? But not everyone is empowered to do that. Also, outcomes for people inside these systems are worse when people are poor and when they're people of color, which is another focus of today's topic. I'm just going to talk a little bit about the youth justice system, which is a system I'm a little more familiar with, a lot more familiar with. So Latino youth are incarcerated at almost twice the rate, and black youth at 4.5 times the rate of white youth who commit similar offenses. And that part is really important, because a lot of people like to say that black and brown kids commit more crime. It's actually not true, and there's a lot of research on that. What is true is that we treat kids differently based on the color of their skin. For example, even though white youth are more likely to report using drugs and 30% more likely to report selling drugs. So more likely to use drugs, more likely to report selling drugs. And by the way, self-reporting in the criminal justice field is considered the most accurate way to gauge behavior, because you can't look at arrest rates because there's disparities in policing and other things, right? So, and also, so they do these surveys where they ask kids, like, about their own behavior, and there's research about the efficacy of those surveys. So that's what I'm talking about. So despite those disparities, and again, it's disparities where white kids commit more drug-related offenses and use drugs more often, African-American youth are twice as likely to be arrested, twice as likely to be detained, and significantly more likely to be prosecuted as adults for drug offenses.
So there's also evidence, as you know, and we're here looking at this topic, that Blacks and Latinos receive lower quality of care than whites in many instances and have worse health outcomes, including higher death rates from the same diseases, even when things like social economic status are accounted for. Now, there are important differences between these two systems, and I spoke a little bit about them, but I really want to just take a moment and honor that, particularly for kids in the justice system, we're talking about often behaviors that are cruel, inhumane, barbaric in a way that the medical system is not. People enter the system in different ways, often for very different reasons. I say sometimes and often for different reasons.